morning, students. Today, the topic which we are going to discuss is individual therapy and client centered therapy. The learning objectives of today's topic are individual psychotherapy. You will understand what is meant by individual psychotherapy, aims, what are the different aims of individual psychotherapy, indications for individual psychotherapy, therapy process, what is the therapy process when we are giving individual psychotherapy to a particular individual, stages of psychotherapy, and in the last, the approaches of psychotherapy. The next topic which we are going to discuss today is client centered therapy. In that, the learning objective will be you will able to understand the meaning of client centered therapy, purpose of the therapy, six conditions required for therapeutic change, main components of client centered therapy, and the process of therapy. Now, introduction. Based on the number of clients, the psychotherapy is classified into two types. Means we can divide or classify this psychotherapy into two types on the basis of number of clients. Example, individual psychotherapy, where therapists will treat individual client. The first classification is an individual psychotherapy, where therapists will treat an individual client at a particular time, and group therapy, where 8 to 10 homogeneous group of clients will be treated at a fixed time. When we are talking about the group therapy will be given by the therapist at a fixed time, and the number of clients that can be in a group therapy can be from 8 to 10. Now, the definition, individual psychotherapy is the method of bringing about change in person, means it's a way of bringing change in person by exploring his or her feeling, and that change in a particular individual will be done by exploring his or her feeling, attitudes, thinking, and behavior. And we want to bring change in person by exploring his feelings, attitude, thinking, and behavior. Therapy is conducted on a one to one basis where only a therapist and the client will be there. The therapist treat one patient at a time, means the therapist will treat one patient at that particular time. That's why we are saying that it's a therapy where a therapist will give the therapy to the client on one-to-one basis. Patients generally seek this kind of therapy based on their desire. Means if the patient desire that he wants the individual psychotherapy, then only that kind of therapy will be given to that particular individual. Establishing one-to-one relationship, that there will be a relationship that will be established between a therapist and the client, and that relationship will be one-to-one relationship between the therapist and the client. It is the key to the success of the therapy. The relationship that will be framed or made between the therapist and the client is the key to the success of therapy. Both must be compatible for therapy to be effective. The therapy will be effective only when both of them are compatible to each other. Therapists vary in their formal credentials, experience, and mode of practice. Aims of individual therapy are: the therapist has to make the client to understand his feeling and needs. Means the therapist's work is to make the individual understand what are his particular feeling and what are his needs. This is the duty of the therapist to make them understand, to modify the maladapted behavior. Now, the second aim is that they ask the client to change the maladapted behavior, to improve IPR, to get relief from stress or unhappiness, and the aim will be to make them relief from the stress and unhappiness, to make personal changes and to bring personal changes in that particular individual. Now, indications: stress related disorder can be a cause of individual psychotherapy. Alcohol and drug abuse disorder individuals can also contact the therapist for individual therapy. Sexual disorder and mar- marital disharmony are the indications of individual psychotherapy. Now, therapy process. When the client comes from OPD, therapists observe the behavior and assess the client is indicated for psychotherapy. When a clients come from OPT, therapists observe the behavior and assess whether the client is indicated for psychotherapy or not. If indicated, fix the therapeutic schedule, venue, time, and etc. If the therapist consider that therapy must be given to that particular individual, then he has to fix the therapeutic schedule. Then on that particular day, on that particular time, at this particular place, you have to come for your therapy. Therapists provide conductive environment with comfortable sitting arrangement to enhance relaxation to the client. Means the therapy should be done in an environment which is very conducive to the client. The therapist must provide with comfortable sitting arrangements so that the client must relax at that particular place. The patient is encouraged to discover for himself the reason for his behavior. And during the therapy, the therapist will encourage the patients to discover for himself that they have to find out themselves what are the reasons why they are behaving in such a way. The therapist listen to the patients and offer explanation and advice when necessary. Now, what is the role of the therapist? The therapist will listen to the patient, what he is saying, and after hearing the patient, the therapist will offer explanation and advice wherever he thinks that it is necessary to give them. By this, he helps the patient to come to a greater understanding of self. By this process means when the therapist asks the patient to say, at that time the therapist were doing that he comes too close to the patient so that he can understand better, greater understanding of self, and to find a way of dealing with his problem. All this has been done by the therapist so that he can understand better the client and find a way of dealing with his problem. The relationship between the patient and the therapist proceed through stages. Means it is not that the rapport between the patient and the therapist will establish or immediately. It's not like that. The relationship between the therapist and the patient proceed through stages, similar to those of the nurse patient relationship: introduction, working, and termination. Now, stages of psychotherapy. Three stages of psychotherapy. Now, the first one is introductory stage. In this stage, the client and therapist meet and began to work together. Now, it's an introduction stage. It's the first stage of psychotherapy. In this particular stage, the client and the therapist meet at a venue which is pre-decided at a particular time that is fixed, and they start working together. Involves taking a history of the client life, The therapist try to know the case history of that particular client, including any medical problem and current medications. And the therapist will focus on any medical problems if the client has having any medical problem and current medication. If the client is a referral, the therapist may already have the information. Many physical illness resemble emotional problems or the reverse. Referrals or consultations may be indicated at this to understand the problem better. The exploration of the patient's background and problems will include any precipitated factors or events that lead the client in seeking help. Clients are asked to discuss their perceptions of their challenges or problems, needs or expectations of their challenges or problem, need or expectations, and the desired outcome of their therapy sessions. During the introductory stage, the therapist forms up preliminary idea about the client needs. Means at this stage, the therapist will know that what are the needs of my client. The therapist want to know what are the particular needs of my client. Together, client and therapist discuss issues. Together, the client and therapist discuss issues such as the length of time therapy will require, how much time it will be required to complete the therapy push, meeting dates, on which date they have to meet, location, what will be the fees, how much fees will be charged by the therapist, and so forth. Now, the second stage is working stage. Now, the introduction portion has been completed. In the working stage of the therapy, the client is able to become more trusting. The client develops trust over on the therapist to disclose and to begin exploring with the therapist. Now he will start disclosing what are his problems, how he has to get out of this problem, and to begin we are start exploring with the therapist the needs, how the problem can be solved, what can be the solution, what is the way of getting the solution of those problems, the thoughts, feelings, and behavior that lead to the pain or problem. Again, in the past, the exploration may have taken months or years to complete. Today, the whole process may be completed in 20 sessions, means 20 the therapy session. Increased trust allows the client to experience greater recall. When the trust will be established, then the client will experience greater recall and insight and to express previously repressed feeling. Now he will able to express the previously repressed feeling when the client had established trust on the therapist. As the client understands and functions more effectively, client will understand and it start functioning more effectively. The last stage of working through its reach. Now the third stage is the termination stage. In the final stage of therapy, the working thought stage, The client achieves a higher level of understanding or the self and relationship with others and began to try out new ways of perceiving, thinking, feeling, and behaving. And he will try out new ways of looking at things change. As the client interact with others when he is interacting with other people and sees newly acquired coping skills, changes are reflected in external behavior, in interactions with others. The client may need a great deal of support and encouragement during this stage. Means at this stage, he requires a lot of encouragement from the therapist and may rework emotional material more than one time. All the clients do become more autonomous and ready to live their own life. They want to live their life on their own. Termination of the therapy is viewed as a kind of separation and loss, and the client may experience grief. Now, approaches. Different approaches are there, and these different approaches are four main approaches that we are going to discuss. The first one is psychodynamic therapy. Second one is humanistic therapy. Third one is behavioral therapy, and the last one is cognitive therapy. First, we are going to discuss psychodynamic therapy. Psychodynamic therapy is the primarily based on psychoanalytic theory. So, psychodynamic theory is based on the theory of psychoanalytic. The assumption that when a patient has insight into early relationship and experiences as the source of his or her problem, they can be resolved. Now, humanistic therapy centers on the patient's view of the world and his or her problem, view of the world in which he is living and his or her problem. The main goal is to help the patient realize their full potential through the therapist's genuine, unconditional positive regard, which fosters the patient's sense of self worth and empathetic understanding of the patient's point of view. This therapy is non directive but focus on helping the patients to explore and clarity his or her own feeling and choices. Now, the humanistic therapy is a non-directive in its approach, but it focusing on helping the patients to explore and clarify his or her feeling and the choices. The third approach is behavioral therapy. Behavioral therapy does not foster awareness but emphasizes the principles of learning with positive and negative reinforcement and observational modeling. The last approach is the cognitive therapy. Cognitive therapy focuses on identifying to find out and correcting distorted thinking patterns that can lead to emotional distress and problem behavior. Cognitive therapists believe that patients change their behavior by changing their maladapted thinking about themselves and their experiences. Patients are taught problem solving skills. They are made to learn how to solve their problems and stress reducing methods and the methods which can be employed to reduce the stress. They learn that their psychological difficulties or problems can be solved through cognitive process and the client learn that Their psychological difficulties or problems can be solved through cognitive processing. Now, the next therapy that we are going to discuss is client centered therapy. Client centered therapy, also known as person centered therapy or Rogerian therapy, is an approach to counseling that required the client to take an active role in his or her treatment, with therapist being non directive and supportive. Now, when a therapist has decided that he will cure the client with the help of the client centered approach, that approach required the clients to be in an active role, and the role of the therapist being non directive and supportive. Carl Rogers, January 8, 1900 to February 4, 1987, a humanistic thinker, believed that people are fundamentally good. He developed the client center during 1940s and 1950s. Roger believed people are capable of self-healing, means they can heal themselves, and personal growth, and they are capable for their personal growth, which leads to self-actualization, an important concept in client-centered therapy. And this is an important concept when we are talking about the client-centered therapy. How does client-centered therapy work? The primary objective of the therapy, that is client-centered therapy, is to resolve the incongruence of the clients, to help them able to accept and be themselves, that they have to accept themselves and be themselves, what they want, how they want themselves to be. Now, purpose of the therapy: foster a close agreement between the client, idealized and actual self, better understanding, lower level of defensiveness, guilt and insecurity, foster more positive and comfortable relationship, that they have to foster a positive and comfortable relationship with others, and increase capacity to experience and express feeling as they occur, and to develop and increase capacity to experience a thing and express their feeling as they occur to them. Now, concept of self. Self is an outgrowth of what a person experiences, what a particular person is experiencing. And awareness of self help a person differentiate him or her from others. And an awareness of self help a person so that he can make a differentiation between him from other people. Real self and ideal self. Positive regard. Now the main components. The first one is congruence. Refers to therapist openness and genuineness, willing to relate to client. Now in that the client or the therapist wants to relate to the client. And the second thing is that therapist openness and genuineness are needed. Unconditional positive regard. Therapist accepts clients totally for who he or she is. Means now it is the role of the therapist to accept the client as he was. And he has to accept the client totally for who he or she is. Third one is empathy, showing emotional understanding and sensitivity. Now, the client or the therapist has to show emotional understanding and sensitivity towards the client. Six conditions required for therapeutic change. The first one is Therapeutic client psychological contact means there should be a psychological contact between the therapist and the client. Client congruence, therapist congruence, therapist unconditional positive regards what the client is. Therapist empathetic understanding. The therapist has to be a such that he should be an empathy towards the client. He should have an empathetic understanding towards the client. Client perception, how the client is perceiving the things. Now, process of therapy. Client talk about external part of self. Now, the client and the therapist start having a conversation. And the first thing is that clients start talking about the external part of self. Client describe feelings but do not recognize them. The client is describing his or her feelings to the therapist, but he or she does not recognize those feelings. Client talks about self. Now he start talking about the self and as an object in terms of past experiences. Now the client will start expressing his feeling in relation or in terms of past experiences that he had. Clients accept own feeling. Now the client will start accepting his or her own feeling. Client express feeling fairly. Now a rapport has been established between the client and the therapist. Now the client start expressing his feelings in a more freely manner. Client express feeling in present and now he start expressing his feeling in present. Client trusts new experiences. Now he is having new experiences and relates to others openly and he will start relating to other people in an open manner. Now the therapy techniques are listening. A therapist has to start listening to the client what he is saying, accepting his or her individuality, his role, respecting his individuality, his ideology, his viewpoints. Understanding the therapist has to understand what are the feelings of the client, responding, and then he start responding to solve the problems and how he has to deal with other people. Now, C.H. Peterson first is understanding this client. You have to understand the client. Second, respecting the client. You have to give the respect to the client. Third, genuineness. You have to be genuine with your client. Fourth, specify rather than generality. The client is the initiator of every process need. Counselor must be active, but not in the directive or controlling way. He must be in the actively involved, but not in a directive or a controlling way. Counselor do not take responsibility away from clients. Counselor must help clients to be more assertive. Counselor must maintain respect and care for the client. Now the counselor has to maintain the respect and care for the client. Let the clients be involved in obtaining their own decisions, and it is the role of the therapist is such that they should involve their clients to obtain their own decisions. So, students, today we have discussed about individual, and client-centered therapy. For further reading on this topic, you can refer these references, as MCQs are the best way to know the learning outcomes of the learner, how much they have understand a particular concept. Now the first one is individual therapy meets the standard of best practices when it's include all of the following except. Now the options are A, theory choice, B, adherence and familiarity with only one theory, C, determination of the cultural relevance of the selected theory, or it's D, appraisal of the empirical evidence for and against the selected theory for the case at hand. So, students, these are the options, and now you have to select the correct answer on the basis of the choices that were given to you, and the correct answer will be option B, that is adherence and familiarity with only one theory. Now, the second one, the interview accomplish all of the following major social skill tasks except establishment of rapport between the therapist and the client, the gathering of information necessary for assessment means you can able to get all the information that you consider necessary for assessment. The enhancement of a therapeutic process. And the last one is the acquisition of declarative knowledge. So these are the options, students, and now you have to select the correct answer on the basis of the given choices, and the correct answer will be option D, that is the acquisition of declarative knowledge. Now the third one, a generic planned change process of social work practice consisting of a first rapport, establishment of a work relationship, B, assessment, C, contracting, D, goal setting, or it's D, all of the above. So, students, these are the particular choices, and now you have to select the correct answer on the basis of the given choices, and the correct answer will be yes, the correct answer will be option E, that is all of the above. Now, the fourth one is historically, direct social world practice has been conceptualized in all of the following way except. Now, the options are casework, case management, C, individual psychotherapy, or it's D, journalist practice, or E, policy practice. So, these are the options, students, and now you have to select the correct answer on the basis of the given choices, and the correct answer will be option E, that is policy practice. Now the fifth one, therapy has been informed by all of the following theories except, means therapy has been informed by all of the following theories except which theory has not informed about the therapy. Now the first one is pharmacological, B, psychodynamic, C, cognitive behavioral, or it's D, narrative, or it's E, all of the above. So, student, these are the options, A, B, C, D, E. Now you have to select the correct answer on the basis of the given choices, and the correct answer will be option E, that is all of the above. Now the sixth one, indirect practice has been conceptualized in all of the following ways. Means indirect practice has been conceptualized over time in all of the following ways except. Options are as private practice, B as administrative or management practice, C as planning and organizational practice, D as community organizing and social action practice, or is D as policy practice. So, students, these are the options available for that particular question, and now you have to select the correct answer on the basis of the given options. And the answer will be yes, the answer will be option A, that is an private practice. Now, the seventh one, according to Bystick, all of the following are core values in direct social work practice, except. Options are A, acceptance, B, non judgmental attitude, C, confidentially, D, client self determination, or it's E, all of the above. So, students, these are the choices, and now you have to select the correct answer on the basis of the given choices. And the correct answer will be yes, the correct answer will be option E, that is all of the above. Now, the eighth one, direct declarative knowledge consists of all the following except A, intuitive and creative knowing in the therapeutic movement. B, a cognitive map of learned taught concepts. C, casual knowledge of individual resilience. Or it's D, casual knowledge of individual vulnerability. So, students, these are the options A, B, C, D. Now you have to select the correct answer on the basis of the given choices, and the correct answer will be yes, the correct answer will be option A, that is intuitive and creative work in the therapeutic movement. Now, the ninth one, all of the following are aspects of tactic knowing except. Now, these are the options. Option A, use of highly disciplined and automatic procedural knowing. B, self-regulated ability to reflect and adjust performance in the therapeutic movement. C1, ability to reflect on action, or it's C, ability to reflect in action. So, students, these are the options A, B, C, D, and now you have to select the correct answer on the basis of the given choices, and the correct answer will be option C, that is ability to reflect on action. Now, the 10th one, managing transferable and counter transfer is critical in one of the following theory based models of therapy. Now, the options are A, behavior modification theory, B, cognitive behavioral therapy, See psychodynamic model of therapy, or it's the solution focus models of therapy. So student, these are the options for that particular question, and the options are A, B, C, D. Now you have to select the correct answer on the basis of the given choices and psychodynamic models of therapy. Thank you, students. With this particular narration, you have understood the concept of individual therapy, how individual therapy is different from group therapy. When we are talking about the individual therapy, we are saying that it is one to one therapy session in which there is only the therapist and the client. The therapist and the client first establish the rapport between them so that the client will express his or her feeling in a genuinely way in front of the therapist. There are three different stages of individual therapy, and we are saying that the three stages of individual therapy include: first one is introduction, where the therapist and the client tries to establish a relationship. The second one is the another stage of uh, therapist, in which the client has make a relationship, uh, or knows what is the introduction of the client, what are its feeling. Now he start working on that. So the second stage is the working stage. He start working on the problems of the client and tries to get the solution of those problems. And the third stage is the terminal stage, and this is the final stage. Now the changes has been made in the behavior, attitude, feelings of the client, how he is dealing with other individuals. Then we have discussed about the different approaches of individual therapy, and we are discussed that there are four approaches of individual therapy. Then we have discussed about the client-centered approach. The client-centered approach is also known as Rogerian approach. In this approach, the main focus of the therapist is that the client is to be actively involved in his her treatment, and the role of the therapist is non-directive and supportive. Then we have discussed the purposes of client-centered approach, the aims of client-centered approach, what are the stages of client-centered approach, and then we have discussed about the how the client-centered approach should be used by the therapist to change the behavior of the client. Thank you, students. Thank you so much for your patience listening. So, in the next class, we will discuss about the group therapist, how the group therapy will be beneficial for the individuals, and how the group therapy can be worked out by the therapist. Thank you so much.